Lungs auscultation. Perform hand washing before the contact with your patient. Provide privacy. Greet your patient and clean the stethoscope with cotton ball, moistened with antiseptic. The stethoscope is stored in bag or pocket. The auscultation room should be quiet and warm. Place the patient in front of you and start the auscultation. The film method is used for auscultation of the lung. The stethoscope membrane increases the sound. Membrane is used to listen to high-frequency sound, the bell to low-frequency sound. The comparative method is used. Auscultate all major regions of the anterior chest wall. Ask the patient for quiet breathing through the nose to assess the main respiratory sounds. Move the stethoscope bell to the subclavian region, to anterior chest region. Listen the area at the level of 4 to 6 intercostal spaces. Listen and compare the lower lateral parts of the lateral chest, upper lateral parts of lateral chest. Perform auscultation of the posterior chest. Listen the sounds for 1-2 breath-in circles in the suprascapular right and left side. Compare sounds. Ask the patient to cross his arms and listen interscapular space to compare sounds. Auscultate the area under the scapulars. To reveal adventitious sounds, ask your patient to perform following commands. Deep breathing, breathing with open mouth. Ensure that patient is not hyperventilated. Cough, forced exhalation, and false breathing. The auscultation technique is built up depending on the goal of auscultation. Auscultation should be very careful in a patient with complaints. Change bell to membrane to characterize sounds of different frequencies, high frequency or low frequency. Clean the bell and membrane of the stethoscope, discard disposable equipment, perform hand hygiene, characterize the sounds. For example, right lower part of posterior chest under the scapula can give us decreased vesicular sounds and crackles.